Hello, everyone, and thank you for coming back again tonight. We're going to do a continuation of things that are done in the early postpartum period, right after your baby is born, to be able to assess your baby's health and to do some blood work. So, what I want to do is to explain what those exams are and the type of blood tests that will be done. First of all, after your baby is born, there's a lot of busyness. You'll see a lot of people buzzing around trying to get things done. We talked about the APGAR score last week. But some other things that happen is ointment for the baby's eyes. This ointment is applied to help prevent the any gonorrhea. So if mother had gonorrhea during the pregnancy and it was not, baby passes through the vagina and the birth canal, then we are running the risk of the baby being exposed to gonorrhea in the birth canal. If there is exposure, there can be some redness and swelling of the eyes. And so this ointment is given to prevent the presence of gonorrhea or to prevent gonorrhea from occurring. The other thing that some families do and do not want is the vitamin K shot. The vitamin K shot is given to help with blood clotting for the newborn. Other exams that are done, your baby is going to get a hearing test while the baby, if you're in a hospital, before the baby is discharged home. If you have your baby at home or in a birth center, then the hearing test would probably be done with the pediatric visit that you will be planning and taking your baby to. One other test is to look for yellow jaundice. Now, what is yellow jaundice? Well, the baby's liver is still immature, not fully matured yet. There's also a whole lot of red blood cells circulating in the baby's body. And so, what will happen is these red blood cells, as they break down, will create what's called bilirubin. And the liver is what is helping to what shall I say, take care of this bilirubin in the baby's system. So your baby is going to be evaluated daily to check for yellow jaundice. And if that yellow jaundice is high, then the baby would need to be treated. A blood test that's done is also called the bilirubin test. And that would also look to the measurement of the level of bilirubin in your baby's bloodstream. The test that would be done is lights. The baby would be placed under particular lights to help break down this bilirubin in the baby's body. And this is something that you can talk to your healthcare provider more about. Other tests that are done include the blood type and the Rh factor. It's important to know the Rh factor for both the baby and the mom. Mother can be Rh negative, baby can be Rh negative, mother can be Rh positive, baby can be Rh positive. If there is an occasion where the mother is Rh negative and the baby is Rh positive, then that would cause the mother to need a shot, which will be called RhoGAM. And what the RhoGAM does is to help her to not create antibodies against the Rh factor. And this is important for the next pregnancy that occurs. Other blood tests that are done is, we talked about the bilirubin, but there's some tests that the government asks to be done to check for metabolic disorders. One of those tests is called the phenylketonuria, or the PKU test. That's a test that's done to check for any kind of metabolic disease. There might be some other things. Some of those metabolic diseases can be things such as sickle cell anemia. That's one. There's other metabolic tests that are done. You can also, again, ask your healthcare provider about this information. So this is what we have tonight when we talk about some of the normal kinds of examinations and blood tests that will happen with your baby after birth. We will talk next week in regard to what happens with mom, some of the normal things to expect once mother goes home. in regard to her care and also the care of the baby once the baby is at home, what is normal and what would be considered abnormal when you would need to contact your healthcare provider. So that's the information that I have for tonight. I want to keep you posted to the fact that I'm going to be starting a coaching program. The very first day of it will be on the 20th of November. I will put information in the chat and also in the description of this video in regard to some things that are coming up. This coaching program is meant to help families be able to maneuver pregnancy and maneuver the healthcare system and end up with a birth plan that will help them to have the pregnancy that they desire as well as the birth that they desire. So I want you to keep your eyes and ears open for this. It's coming up very soon. This will be a 3 to 4 week program where we'll be meeting once a week. The fourth week would be to allow for there to be individual consultations with me to be able to review any information that you have or may have any questions about. The other is that for my YouTube channel, I'm going to ask all of those of you who may be following me on Facebook to move over to the YouTube channel and subscribe to my channel there. That helps me to with the algorithms for YouTube. It also gives you notification for any new material that I will be presenting. And it just helps to boost this so that people who are looking for this information can find me on the internet. So once again, thank you. I hope that you've had a great evening. I hope that you will have a blessed and great week. And my very best to you. Thank you. Good night. Bye-bye.